into. So thank you all for joining us in the dog days of summer. I don't know what it's like where you are, but I just checked the heat index here and it's 96. So, but that still beats Phoenix last week, huh, Laura? So our agenda for today, I think it was 114 one day. Anyway, our agenda for today, I'm just going to quickly, from the PMO, give some updates on activities since the index released this spring and our last conversation in May, and just a tip for some follow-on activities that are coming up. Then we can talk about where we are in terms of the 2017 release planning. Of course, the 2017 index release will cover data from 2016. So, but I'll talk to you a little bit about where we are in there. To talk a little bit about this, then to go back and have some conversations about this year's release. I would love to hear from you guys if you're getting any feedback from the field, if your colleagues or your stakeholders are saying anything about the index or using anything about the index, particularly as we start thinking about this September use event that we're going to briefly touch on, that McCabe and RWJF are putting together. I think someone just joined. Hello? Maybe someone just dropped off. I'm not sure. Then I'd like us to have a conversation about stakeholder engagement and outreach, because we have limited resources in terms of money and time and staff, and want to make sure that we're connecting with the right groups in the right venues to make sure that we're both maintaining and expanding the index's reach moving forward. So just to have a conversation with you guys about where you see those needs, where you see us needing to put in extra effort this year, both as a program management office, but also as an engagement and communication team and work group, and where we might be able to reach out to folks. Then talk a little bit about the work group, and this is going to build on that sector's discussion. Who's missing from this work group, and how can we have a more functional work group with more a more robust discussion and different perspectives coming to the fore. And then if we have time, talk just a little bit about potential work group activities. We'll talk a little about what we did last year in terms of qualitative, quantitative kinds of reviews, and most of that was focused on the website, but there was some discussion of use and usefulness, but how we can build on that and do a better job of all of it this year to make sure that we're capturing what everybody needs. And then some other business. I've got a few housekeeping items, and then I'd love to hear anything that you guys have on tap. So that's where we're going. Does anyone have any questions about any of that? All right, thank you. Well, just very quickly for the updates section, we have had some additional activities since we talked in May. We've had a couple of high-profile blogs placed, one in The Hill and one in Health Affairs. Both of those were written by Glenn, the director of the Program Management Office, and were really designed to encourage those from a policy standpoint to begin just looking at the index and exploring it and seeing what they might learn from it. We also, last week, were at NHO with in Phoenix with a poster on a preparedness index, again, beginning to look at this use and usefulness issue, trying to talk about how the index might be used by local practitioners. Swanee Jett from Florida was our co-author on this poster, and so we took Florida as an example of the kinds of things local public health might want to look at in terms of where they're building coalitions and where they're working with the state and what kinds of issues and information the index can provide for them. And that is available if you were at the NHO meeting. There was a scannable chip at the bottom, so there's the full poster is available on the NHO meeting site, and it's also going to be on the index website soon. And then just to touch on Twitter, I don't know if Emily Friedner is on the line or not, I know Jen Chu was going to join us, and I know Bree's on the line, but we broke 100 followers on Twitter, and I want to say thank you to McCabe, especially for all of the work they have done to start building that follower base, and we're sure it's going to continue growing. But tweets are coming more regularly. They're reaching out to important stakeholder audiences, and I think that it's starting to return some rewards. Any questions about any of that, or comments, or thoughts anyone wants to share?
So, and I'm not sure if you mentioned this, you might have, but did you see that there was a Washington Post article?
Oh, I did not mention that one. Would you like to I'm sorry, would you like to note that for folks and just tell them a little bit about that one?
Yeah, no, there was a recent Washington, I forget which day it was, but it was talking about Zika, and it did mention, and particularly the Zika funding, and the fact that Congress had not passed supplemental Zika funding, and mentioned that particularly for those southern states that were lowest on the preparedness index. I think that's, I hope that's not paraphrasing badly, Anna, but I thought that was a nice plug.
Absolutely, and the byline was Paul Keenert, wasn't it? Am I right in remembering that? I think it was Paul at RWJS. So, absolutely. So some of you may have seen that. Did anyone see that piece? That was last week before last? The summer goes by so fast.
Yeah, I think I saw it. It was Kathy.
Excellent. So we are, one of the things we learned, even with a suboptimal turnout in the usefulness and usability survey that we fielded, with about 50% in the public health of the public health sample responding. One thing that was pretty consistent across the board with those, and the handful of emergency answers we heard from, was that people were not using the index throughout the year. They were not going back to it. They were sort of looking at it when it launched, and that was it. So a lot of these blogs and articles and posters and all that are designed to really help us drive attention back to that website. And I was hoping to be able to give you some numbers and see if we had dropped off since the launch, which I would expect, but see how severely we might have dropped off. But I'm sorry I don't have those numbers for you today, but I will have them for you in August. Unless Bree knows something I don't.
That's we haven't received a website update either.
Okay. So we will try to get you guys some numbers on that in August, so we can think about if the website is retaining an audience or driving new folks in. And I want to talk a little more about that website piece in a few minutes when we get to planning for next year. Just a few updates. Go ahead.
Quick question. Can you give us a little synopsis about Florida's experience and how they used it?
It was a prospective. It wasn't a retrospective. It wasn't how they have used it. It's how they intend to use it. And so if I could pull up my poster here, I just had it open. That's not it. It was largely out of the playbook that's in the toolkit, using it to inform collaborations and strengthen decision making and do quality improvement work, those kinds of things. Let me toggle here. I'm trying to be on 3 screens at once.
That's okay. I thought maybe they'd already used it. I wasn't sure.
No, it's how they're planning to use it. One thing we heard last year, and I heard it from our very first call, Laura's team very kindly invited us to talk to some of the NHO PPOM folks, and very early in the process, and there was a real desire to use it, but there wasn't a lot of expectation that it would be usable with the state level figures. So we've just tried to identify some areas. So let's see, the text we put in here is support quality improvement at the local level by enhancing understanding of what influences health security and how the work of various sectors and components intersect, while galvanizing action towards strategic and operational quality improvement. It can inform resource and policy decisions by helping identify the types of efforts that need to be developed and sustained to support effective responses, and while demonstrating how quality of everyday systems influence response capabilities. It can enhance collaboration and strengthen shared responsibility by highlighting areas in which partnerships and collaboration should be fostered. And it can serve as a call to action for improving data collection, evidence-based targets, and research to identify effective approaches. So it was very general and very prospective.
Right.
But we felt it was important since what we had learned last year in talking to some of the local public health preparedness folks was that there was a desire to use it, but some need for some guidance there. There was, we were really just trying to tee it up more than anything.
Mm-hmm. Right.
Right. And that's something that we're going to continue doing over the next few months, is try to tee up the different ways the index can be used. And there are some, I know that some other staff in the PMO are working on some potential blogs for the website on use, and there are going to be some activities around Preparedness Month in September, some of them web-based, to talk a little bit about, how more specifically about how you use the index. And I know RWJF and McCabe's teams are in discussions on exactly what that's going to look like, and I was going to get to that in a minute, but I might as well touch on it now. And we're hoping to have that ironed out in the next couple of weeks with the NAC to make sure we're all on board with how that's going to work. But so we're really looking at teeing up use and getting people using the index so we can see how that's going. And one of the questions.
I'm sorry. I was kind of similarly an idea you might want to think about. We might want to think about doing in that arena. I don't know if this is feasible, or maybe this is the wrong time on the agenda to bring it up. But one thing I've done with projects sometimes in the past has been to identify a locale or a state or a partner, and do a little pilot with them. Maybe just put a little funding into it, in terms of using it and working with them directly in the field. So you kind of get we actually watch them use it and see how them use it and support it and learn something through supporting and focusing with an entity or two, if that's ever feasible. We might learn more about use and the barriers to it by working closely with somebody on the ground.
Exactly, and those are the kinds of conversations that are going on right now. I know at RWJ and with McCabe, and we've provided some input in some different areas. So those are some important opportunities that we do want to explore if at all possible. So that's fine. I can't say a whole lot yet about what that's going to look like because it's still sort of in negotiation, and the NAC hasn't had a conversation yet. But there are some ideas being bandied about. I think in the immediate term, dissemination and implementation science tells us that 3 months after the index is issued, people aren't really going to have concrete results-based uses to stand up as exemplars yet on this year's index.
No, and I think is, people are busy, and they've passed that stage where they kind of had the interest in it, and maybe we need to do some. I guess what I was thinking about was, to proactively identify someone that, and maybe we fund them a little bit with it to do a state pilot or a local pilot with some very specific activities that through which you might develop some tools that would support use elsewhere. You might identify barriers for using it and facilitators for using it. Anyway, sounds like you're thinking about those ideas down the road.
Thank you, Kathy. Yes, that's great input, and I'm so glad you shared that, because there have been discussions about doing some use fostering in the short term and the longer term. And in the short term, obviously, we wish we could have some nice use examples to stand up by Preparedness Month, but I think what we're probably going to end up having are more, these are ways you can, examples, again, perspective kinds of things, with the hope that a year from now, Preparedness Month 2017, we could have some real success stories or some lessons learned to share with
we may need to be pretty. I think we may need to be more proactive in youth, because I think we're
exactly
we're not seeing people pick it up as rapidly as you might think. We were thinking earlier.
Exactly. So I thank you for that. Does anyone else have any thoughts about? We're a little bit jumping around in the agenda, but I think that's fine. Does anyone else have any thoughts while we're touching on this about ways to encourage use, in addition to perhaps priming the pump with some funding to support and encourage some efforts? Well, keep thinking about it, because I'm sure we'll be coming back to it a few times over the course of the call. While we've got folks online, and especially Bree, and I wish we had Emily too, but I know summer is hard. We had a joint methods and models work groups meeting yesterday. I had to be at a different meeting in Kentucky, but they had their annual in-person meeting yesterday. And they had some questions around communications and usefulness that I was hoping that this group could add to while I've got Bree on the phone, and perhaps expand on some of the ideas they threw out. For example, in that methods and models work group, there were some questions around, we had average time spent on the website, and it was somewhere in the 2.5 to 3 minute range, I think, when last we looked at that. And folks were wondering, how are people using those 3 minutes? What are they navigating from? Where are they navigating to? What pages are they looking at? That kind of information could be very helpful in telling us what pieces of the index are useful and are perceived as useful right now, and where we might need to shore up some pieces. So does anyone have any insight about that, or anything to add to that particular question for the communication team to explore?
Well, are you collecting the hits to the page and tracking who's on the page, and not so much who's on the page, but how long they're on there and which pages they visit? Are you using Google Analytics to gather this data?
Our web contractor, the RWJS web contractor, Subject Matter, who did the design, also are managing the analytics. But they have been collecting that information, so we know how much time folks are spending. We know how many hits we're getting. I don't know that we've done much in terms of tracking paths, website paths, which I think is really what the work group was asking for, was really where are people coming in and where are they going to?
Yeah. Well, you could probably figure out where they're going to. Now, where they're coming in, yeah, you can figure out when they come to the page where they go from that page, because sometimes they get to the front page, they're on there for like 15 seconds, and then they move to a second page, 15 seconds, and then when they finally get to the third page, they're on there for like 20 minutes.
Mm-hmm.
I know you can track that pretty easily via Google Analytics.
Mm-hmm.
This is Bree. I'm not sure exactly subject matter, but I think that's a question. And I think it would also be interesting for their exiting.
Mm-hmm.
So we can check, get a deeper dive, especially if they begin all of those.
Excellent, because I have several suggestions here from the group. One of which we have in process, and we're just waiting, I think, for the final sign-off, and that is the data being downloadable on the site, downloadable in a spreadsheet that is navigable, that people can actually explore and use. And that is something that is very much in progress and just about ready, I think. I think we're just waiting for one final signature to say it's all clean and it's good and it can go and it has sufficient metadata that folks can navigate and understand it well. So we have that. I think, did someone just join or did we lose someone? We're coming up on the hour, so that sometimes happens. So more availability of metadata, which I think will go with that data downloadability, but also we can explore where that might go in if there are other ways to display metadata in next year's index as well. I would want more feedback from methods and models on what exact pieces of metadata they think are necessary, and I would want to hear from this group what pieces you guys would think are necessary also. So we'll talk a little more about that as we get a little further down the line. Another request from those work groups was to be able to compare measure by measure and state by state on the website. So that's something to explore. I know Kathy has had some interesting experience over the many years she's worked with the index on the issue of comparison and where that is preferred and where that is not preferred. So I would love to hear if Kathy or anyone else on the call has any thought about that a comparison tool that came up out of this work group yesterday, and whether they see that as being helpful or a potential issue when you're talking about measure by measure, state by state.
Well, I think it could provide a barometer for you. I mean, depending on how applicable the tool is. I mean, if you've got something that's two equal websites and seeing who's going to one versus how many people are going to the other, that gives you some indication. However, there's no such thing as two equal websites. And what's driving people to one may or may not help drive people to the Stakeholder website or the current website we're trying to work with.
Well, do you think that increasing the comparability of as you're looking at the index and you're looking at state results on the index, being able to compare a measure, a specific measure out of the 120-ish that are on there, being able to compare a measure across states would be a useful tool that would drive traffic, or are there concerns? And I'm interested in hearing from the practice community on this. Are there concerns that that kind of comparison could have unintended challenges for some stakeholders?
Well, I'm not too sure about unintended challenges. I think the data you collect must be looked at with a skeptical eye. That's the important thing, and not just simply accepted for what as is. Look at it with a skeptical eye, and then try to drill down to figure out why they're coming, what's sending them there, and where we can better encourage people to come to the site to get the information they're looking for. So I think it's going to tell you certain things, but it shouldn't be seen as like the only source, the only piece. It's just going to be one piece of several data points that you need to be collecting.
Excellent point.
This is Kathy. I think there's different potential for comparability and sharing. I mean, I think downloading the data at the measure level may be fine, and it's kind of helpful if you're doing a very close analysis of your own state. Like, I think right now you can't really look at where your state drills down at every subdomain or domain or measure level. You see the domain level, but not the subdomain or the measure level. So I think downloading that data so you can really play with it and look at it as your own state is fine and helpful. I think one principle to keep in mind is that the real strength of the index, I think, lies at the subdomain level. The individual measures are helpful, but they're kind of proxies that are samples across that capability area, and so they're really supposed to and meant to, and you did a lot of work trying to make sure that they align well to roll up and and kind of reflect the capability at the subdomain level. And so I think that's where you have more ability to look and start to wrestle with the questions of, no, why would I be at this level in my state, but 4 states that have similar kinds of threats to what I do are above or below where I am, and maybe now there's a time to get together and to explore that. What do you do and how do you do that? I think it's more about your capability at that subdomain level than it is about did you have every measure within that subdomain marked yes or no, or achieved. So because it's not going to ever be a checklist for preparedness that you get all the indicators. It's really looking at what your capabilities are. So I would think that if you're going to do comparisons, you would want to do it at the subdomain level. And we did do some early on. We did do some asking folks, if you were doing comparisons, what are the most important comparisons for you? And they were interested certainly in terms of their own over time, that kind of comparison. But they thought across states, the ones that we heard the most interest in were, and you'd have to work with the practice community to identify what these factors were, but they were interested in comparing, for instance, along states with similar demographics, or states with the same kinds of threats, or kind of something that was not just here's 50 states and how the states compare. It was really more helpful to think about it, whether it was a region or whether it was your partners or that kind of thing. So I think there are some ways to compare, but you want to think about how does that comparison want to be used. That makes sense.
Excellent. Thank you. That does remind me of one thing that I want to flag for Bree. Something that's interesting. You said, Kathy, that you don't have scores at the subdomain level right now. Did I hear you say that you can't see the measure level scores?
Yeah, on the website you can't see subdomain scores or measure level scores.
Okay, the measure, this is what I want Bree to flag. The measure level scores are there now in the state. If you go to the state and you drill down, the score is at the very bottom of a list. It's measure name, measure source, data, dates, limitations, and score is the very last thing. I think something we need to explore for next year is a better way to present that, because right now you have a column that says measure description and you have a column that says score. And when you click down on score, you get that whole box with the score at the bottom. So it's very easy to miss that there is a score there.
Interesting.
It is very easy to miss that there is a score there, just because of the way it is laid out. So that may be a fix that we need to see if we can institute this year. If we can retroactively refit those pages so that the score is actually appearing under the score column. It's also something that I found that on some computers where I had been looking for it previously, I had to refresh all my cookies in order to see it.
Well, I'm wondering, because I'm on my state one right now, and I still can't see any of that.
Can you go to say?
So now it could be I'll do cookies out, and so I'll try to refresh it. That's interesting, because maybe it's pulling up when I used it before.
Right. If you go to Kentucky, for example, and look under community planning and engagement, and just pull up, say, M501, and click down on the score side, there's a little down arrow. The little down arrow on M501 on the right should say measure name, measure source, data, date, limitations, and then there's a score one at the bottom. And I wasn't seeing the score one either until I got rid of all my cookies. And that's a problem, because most of our folks would be using this index, looked at it when it was released. And if it wasn't there when they looked at it there's a problem with cookies.
Right.
They're not going to see it when they go back. They're not going to realize they need to delete cookies.
Yeah, I'm seeing it in Kentucky, but not West Virginia, because I probably looked at West Virginia before.
So if we
Now, I
could,
don't
if we
see
could,
subdomain scores anywhere still. Are there
yeah,
subdomain scores?
I don't see them. I'm not sure if they rolled up that way this year. I'll check with Mike on that and see if they were part of the spreadsheet that went in.
Yeah, I found the Kentucky. Yeah, I'm finding it on ones I didn't go to before, so it must be the cookie issue.
Because right. So I'll check with our guys and see what those how that subdomain piece works. But if so, the problem is if we have folks who have visited the site early and they were looking for their state scores and they weren't there, and we tell them no, they're there now, and they go back and look because there's a cookie issue, they're still not appearing. Right. So I'm wondering if we go ahead and fix that column issue and break that out differently, so that those columns go in the score, so that those scores go in the column that actually reads score.
Mm-hmm.
If that can fix that cookie problem, because I don't know that it will, but it might require a reload in a way that, I'm just not sure.
And that you know where to look for it. But the other thing I just want to keep talking about, or keep mentioning it too, that it's the subdomain that's more important than the individual measure in a lot of ways.
Mm-hmm.
And so I think we've been doing a lot of measure and then domain and index level, but we're really not looking at the subdomains, which are really the capability level. People kind of can drive some further discussion and say, here we are at this level, and this is what's feeding into that from the measures. But let's talk more broadly about how we really are doing cross-sector collaboration and what is this telling us and that kind of thing.
Excellent. All right. I'm just, in the interest of time, I'm just going to pull us back quickly to our previously discussed, our previously listed agenda, just to get through these last couple of updates, and then we can dig back into the conversation. So we sort of just spun off from that methods and models work group meeting. Let me pull that page back up, because I was just looking at some of the summary notes, and I mentioned a few of the items. Another item that those groups would like to see is some information about how do I print a report on my state. Some better hyperlinking, links to the original data set we've already discussed, links to other open data reports, links to the Culture of Health website, and a query function. There were a lot of suggestions related to communication and use and usability and usefulness that really bleed over for our work group that we can discuss in more depth in the coming months. But I wanted to go ahead and flag those for Bree for when they talk to subject matter next, that we can begin looking at some of those issues. And especially, on the priority on that list for me would be fixing that score issue, and then making sure that we have the data download available. So that happened yesterday. There was some discussion about maybe streamlining our work group process, and I wasn't at the meeting, so I haven't had a chance to fully debrief on this, but I'm not sure if they're talking about combining the three work groups maybe for a quarterly meeting or a semi-annual meeting, or in some way to have the work groups meet together more often. So I think that's a direction we're going to look at, both for the sake of obviously efficiency. If we've got people who are sitting on multiple work groups or who attend multiple work groups, and they're losing 3 hours a month just in work group meetings, but also more importantly for dialogue, so that the folks are talking to each other. And it may not be necessary for every meeting to overlap, because if they're getting in the weeds on Bayesian methods, there may not be a need for the engagement work group to be there. If we're talking down in the weeds about survey analytics or something, they may not be as interested in that, but we certainly want to explore ways of making as good use of your time as we can. So we're going to be having those conversations. And then I just wanted to let you know we do have an August National Advisory Committee meeting. And during that meeting, we're going to talk about production timelines and priorities for next year. So as we do that, once we get that production timeline finalized, we as a group can come together and think about our timeline and what our communication and engagement timeline looks like for the year. And we're going to start that process even now as we get into this prioritization here in just a few minutes. But before we get into the prioritizing sectors and prioritizing potential venues to engage folks, I wanted to check in with this group and see if anyone, Mary or Doug or Kathy or anyone on the line has been hearing much about the index since last we talked. If you're hearing of anyone using it, if you're hearing of anyone interested in it, or if you're hearing any general opinions about this year's edition of the index. And I'm just going to hush and open the floor and hope someone talks.
Well, I actually have heard some rumblings out there about the index. I was on some calls with legislators talking about preparedness, and the issue of the index did pop up. So I know it's gotten some interest out there, and I think we had that dialogue with some state legislators who were very interested in it, and we were able to share the index with them. So we have gotten a little bit of feedback on it, but not a lot. But it has generated some interest.
I like to hear that. I like to hear that it's at least the awareness is starting to raise, even if use is not there yet. That at least we're building awareness across different sectors. Anyone else heard much over the last month and a half?
So Anna, it's Laura. I was wondering when's the last time you went and kind of briefed OPHPR? Or I know some folks are involved, but I was actually speaking to somebody from OPHPR recently, and they were like, that index kind of hasn't been on my radar lately, and so that's not the news you want to hear. But I think maybe some of the activities down in OPHPR and DSLR may need a refresh.
Okay. That actually is what I want to hear, Laura. I mean, it's not a result that I particularly like, but it is something I want to hear so that we can write that as quickly as possible. I believe Glenn was down there about a month before Index launch, so he's probably down there in early Marchish. But,
yeah.
I know we're going to be talking to Dr. Red in the next few days, so that's something we definitely need to connect on.
Yeah, that'll probably be good. I know that I'm still going to keep pushing for us to kind of make the link between the index and their public health impact project a little bit better. So I know that we're going to have a joint meeting with ASCO on the impact project, and I'll keep pushing it from that direction.
That was which one, Laura?
If
the link between what? Just couldn't hear all of it.
CDC has an impacts project where
Gotcha. Yeah.
the impacts project was messaging about the kind of the overall impact of the PEP grant program. I think that
Right.
the messaging about that needs to be linked to the messaging about the index.
Yep. Sounds good.
Excellent. Thank you so much, Laura. And anytime you need any of us to talk to the PBOM or any of the other groups at NHO, we stand ready as well. We really appreciate you, and we really do think it's important to start getting local public health engaged more in the index. And one of the discussions I know at the Models and Methods work group yesterday was this desire to begin branching out. I believe that there was a discussion of first expanding to include territories. I know there's a lot of interest in the territories to be included, and also to look at rolling in large metro areas. And I think there are obviously a lot of issues around data availability and how that all works together methodologically to be worked through over the next, I would say, several months, but it may take us a couple of years. But as we do that, we're certainly going to be needing input from local public health on a number of fronts. So you guys know a lot more about the data availability and the pieces that matter to local public health than we necessarily do. So as we look to expand usefulness in those areas, we definitely want to keep connecting and keep that dialogue going. But I will talk to Glenn about OPHPR. He's usually in Atlanta about every quarter or so. So as he talks to Dr. Red in the lead up to this next National Advisory Committee meeting, we can see what we can do and where we can get back on the radar there. Excellent.
This is
Okay.
Mary.
Yes.
Since I'm in OPHPR, I thought I better chime in. Let's see. So I haven't heard anything about the index lately, but based on what you're saying, I'm thinking I'm going to go back and check and see if there's been any mention of it in our internal newsletter. And the next time Glenn comes, it might be a good idea to see if we can arrange for him to like give a seminar or presentation or have discussion with some of the folks in the Division of State and Local Readiness to maybe talk about the index and just raise awareness and talk about what's different in 2016 version and what's coming up for 2017.
Excellent. Excellent, Mary. Thank you so much.
Mm-hmm.
Anyone else? All right, the next question I think we've kind of touched on, but I'm going to put it back out there again, especially because Bree is on the phone and is there thinking about what those September events around use might be, or what they might look like, or what they might highlight. It will be really important for us to, if there are examples of index use really taking place in ways that are meaningful, we really would like to know about them. So if you know of anyone out there who is really making concrete use of the index, and I know it sounds like awareness is being raised among legislators and in other areas, so that's good. But the examples, 3 months out, as we would expect, the examples of actual, okay, we're now using it to do this and this and this, are not as concrete as we might like if we were going to highlight some exemplars. But if anyone is aware of one or more, please do let us know. I'll be quiet for a second and give an opportunity to chime in. I don't expect there is much at this stage, but is anyone aware of anything that we're not at this stage? Kind of what I thought. Okay, thanks, guys. Moving on, as you remember, if you were on the first call we did a year ago or so, we talked about some of the different sectors we really wanted to reach in the work groups to make sure that we were hearing the voices of those particular stakeholders, and also that we had gatekeepers to those communities. So this is just me spitballing a few of those kinds of sectors and organizations, and in the interest of spurring some conversation and seeing if who's missing, who's not on this list that should be. I know this is a conversation we keep coming back to, but there are some of these groups we really need to connect with. Emergency management, in my opinion, of the folks who are not fully engaged, have to be at the top of the list, because I've just heard so much from so many sectors, including the public health sector, about how essential it is to get them really re-engaged and reinvigorated. So we've got public health, we've got emergency management, healthcare, nonprofit and volunteer, which I've kind of put there together. They don't, they may have different functions, but I've kind of put them there together. Private business and industry, legislative at the state and federal level, the research community. But who's missing? What sectors are we missing in that list? Does anyone see a big hole that we need to fill there?
Have academia on there?
I kind of lumped them in with research.
Gotcha.
I thought sort of, because I didn't want to drop out the folks like Rand and some of the other more policy research folks too. So I feel like when we say academia, it just sounds like a bunch of boring professors and assistant professors like me sitting in a room somewhere. But absolutely, they're in that group. Others, and public health, by the way, I mean local, state, and federal. Sorry, go ahead.
I was going to say, what about the media sector? Is there any particular element of that that might be useful to engage? I'm not sure, but I just thought I'd bring it up.
Media?
Yeah.
That is a very interesting idea that I like a lot. Bree?
I'd like to chime in there. Of media as
Sometimes in my experience, I think they're important to reach, and they're important to partner with in many ways. The challenge can be sometimes for advisory groups or work groups, they feel like they're giving up their objectivity, or they're giving up perceptions of objectivity if they serve on, and I work in environmental health sometimes with advisory groups, so this is a different venue that we're talking about here, but politically I've had some problems sometimes getting media on work groups and advisory groups just because they were concerned about perception. So I'm not sure, but there might be some gatekeepers to media communities that we could think about. Some bridging groups who are tightly connected. Of course, we do have McCabe serving here in a sort of ex officio capacity. McCabe and McCabe Message Partners. I'm not going to call them GYMR. I'm not.
mm-hmm.
But they are tightly connected with a lot of media. But I agree that we need to think how we can strategically engage them, if not through work group membership, where and how do we hit that? Does anyone have ideas about that?
I wonder if there's an organization for like science journalists. That might be something that might be useful.
There is an association of healthcare journalists, but again, I'm just not sure what we offer audience or just
Perhaps
to
you need like
offer
a media, perhaps you need like an outreach strategy of some sort about, we will send this out to media, we'll put this out on social media, we'll put this on Twitter out.
And
that
is what we have been doing.
Yeah, and we'll have, as I said, we'll have new calendars and new task lists to share and to get some very specific input on after this NAC meeting next month. When we know what the production timeline is going to look like, that will position Bree and the team at McCabe to think about their scope of work and where we need to be fitting pieces in. And then we can have a discussion about what that looks like, and if we feel like there are specific pieces that are being missed or opportunities that we might capitalize that we're somehow that we're letting slip past us. I think that's a really good use of. I think that's a really good use of this work group's time, and I hope you all agree, because you know, like I was saying to some folks at NACCHO, you don't know what you don't know, right? That's a saying we all hear, and I am in an office on a university campus, so there are lots of things I don't know. And someone, go ahead.
Oh, I was going to say, well, another route might be to link more with NIFIC, the National Public Health Information Coalition. Yes. And that way you could target, that's all the state and local public information officers for health departments, and you might target them in terms of utilizing the index in their communications out to media or out to newsletters they put out, that kind of thing, keeping it visible.
I think that's brilliant. I think you mentioned that when we met in person in April, and it's something that's on my list that I haven't had a chance to follow up on. But I have good news. I have really good news. I'm excited about this. we are adding some capacity. We are adding some operational capacity at the program management office. Our program manager, our former deputy director for our now retired Public Health Services and Systems Research National Program Office, Ann Kelly, is going to be joining us part-time. She's going to be joining us 40%, so 2 days a week, beginning in August. And she is a trained program manager. She is very detail-oriented. She spent many years with the Council of State Governments on doing policy work. And so we will be adding some operational capacity that is going to help me greatly check some items off my to-do list. And that NIFIC piece that you just mentioned, I had flagged that when we met in April, and it's just one that I haven't gotten to do yet, but that is absolutely someone we want to add. That is an organization. So I look forward to introducing you all to Ann next month. You're gonna love her. She's great, and she makes sure the trains arrive on time. And we continue to have Michael Farnsworth. I'm not sure if Mike's on the line or not. He was at the Methods and Models group this week. He's as those of you who have met him know, he's a graduate student at the University of Kentucky, and he has been helping as well and will continue to do so. But he was going to be on a plane today, so I'm not sure if he's with us. Okay, sorry, I got a little bit off track there. Oh no, we've only got 5 minutes left. Okay, I want to go ahead and just get this piece in and hear your input here, because these are, I just made a quick list of items that we know are coming up for sure, and I'm sure I missed some, but we've got, obviously, the ASTO DPHP meeting is coming up in September. The NEMA Forum is in October. The IAEM Emergency Managers Annual Meeting is also in October, and APHA is October, November. So that's a pretty packed couple of months of preparedness work. I flagged Council of State Governments in December. I don't know if that's something we want to do or not. They did invite us to their Midwest meeting last year, so it's possible that's one we could hit. Obviously, National Healthcare Coalition Preparedness Conference, Preparedness Summit, and then the InvoAd meeting is next May. There is a possibility of us talking to the IOM group on preparedness in the next few months. I have a question mark next to NCSL because I let time get away from me, and it's next month. It's in like 3 weeks.
Yeah, it's like in 3 weeks. And you're not going to be at the convention center?
I don't have it on the calendar right now, so I'm not sure if there are other opportunities to connect via a phone call or another meeting or a regional meeting, or if there's something else that we might be able to do.
Well, we might be able to schedule you to do something at our winter meeting.
Okay.
That might, but probably the best thing to do, I mean, and thinking this, and this is kind of late now, but we might have put together an ancillary session for you on Wednesday afternoon to do a presentation on this and have it set up so you can go in and do a whole presentation on it. And, but obviously at this point it might be a little bit tough to put something together.
At this point, an event planner would hack me up with a hatchet, I think. I would understand the feeling. But maybe that winter meeting would be a good place to target, or another opportunity over the course of the year. So let's you and I connect on that a bit later. Now, one thing I do want to say about all of these items, with limited resources in terms of both money and time, travel money and staff time, we're probably not going to be able to hit every one of these events. And you all probably have some others to recommend that you don't see here. With 2 minutes left, we don't have a lot of time to go into what I would like to ask. Here's my ask of everyone for this call. The two-part ask. Part one is thinking about the sectors and organizations we discussed. if you had the resources to target really strongly engaging one or two of those, what two would it be? And if we could only do, say, 4 to 5 of the venues here, including venues you know about that we don't, which do you think are the priority and why? And I'll send out an email when we finish up here, just asking you guys if you could put it in an email so that we can review it thoughtfully. If everyone could just do that and send us what you think are the top targets and what you think are the top venues that we really need to hit this year, because I know last year I was bouncing all over the country for about 4 months, and that's just not sustainable for a tenure track assistant professor who wants to be employed in a couple of years. So there are a couple of items that we can think about, and one is, are there other surrogates other than Glenn and me from the Stakeholder work group or the Methods and Models work group who might volunteer to talk to some of these folks? I mean, for example, APHA, we're going to be at. We have several posters about the index accepted, so we know we'll be there. But where we know we need to be at the Preparedness Summit. That's a biggie. We were at ASCO DPHP last year. Do we go again this year? So I'll send an email and ask you guys just to please shoot me your thoughts on where the priorities are for this.
Anna, whatever you need for the Preparedness Summit, let me know. Abstracts will be open in as of September 1, August 30th, September 1. But if, think about if you want to, really, I think that's an opportunity to demonstrate the practical pieces of it, like how to use it, why it's important. And so if there's a workshop, if there's just let me know. Anything.
Absolutely. I appreciate it so much, Laura, and we will. We absolutely will, because that's key. That's priority. I'm just going to go ahead and put this out here that Preparedness Summit is a definite. And then what of the others do we need to really target?
Anna?
Sectors and organizations? Yeah.
The other thought, it was great having you go places, but you're only one person. And, I'm thinking, are there other venues? For instance, RWJF does a wide variety of things that would be interesting to have some of their folk reference and talk a little bit about the index as they look at broader culture of health things and other measurement initiatives. And are there folks from that staff that could also integrate this into national gatherings that they do?
I think that's a great thought, Kathy, and I really appreciate it, and it will be shared. They had a resilience workshop just in May. Was it the end of May? I think. And there were a lot of folks there. We had a couple of NAC members there, including our NAC chair and Anita and some different folks. So I think that, and I think also getting our NAC more involved in some of that will be helpful. I think last year was all about let's do the initial touches and make sure everybody knows what's going on and where we are. And I think that we have to spread the joy of the dissemination of the index over the next year. And I think we're going to be looking to the NAC to do that. We're going to be looking to work group members to do that. We're going to be looking to RWJF to do that. So we definitely want to think about strategically who, what, when, where, why, and how, and how we can really make that connection. So that's a great thought, Kathy. Thank you so much. We're over time, so I'm gonna, as I said, I'm gonna put these last slides. I think this work group structure question, to me, it's really the same question as what are the sectors and organizations that need to be involved. If it's a sector that needs to be involved, it's a sector we need to be on our work group. I just don't think there's any question. Maybe not this specific work group, but at least one of the work groups: methods, models, stakeholder engagement. So So I'll ask those in the email I'm about to send out. Let's table this for when I come back, this potential work group activities, for when we come back in August after the NAC meeting, and we can talk a little bit, looking at our timeline, what we have time to do. Last year we had some qualitative feedback. We had some conversations on our calls, specifically about the website. We also asked people to go through an exercise where we asked them questions about the website, a hypothetical scenario, and folks wrote their responses, and that was really helpful to then GYMR, now McCabe, and subject matter and thinking through tweaks to make to the website for this year. So if we want to do that kind of a task again, if we want to expand that kind of a task to the other work groups or not, if we have the resources to do some focus grouping, who do we prioritize there, how we can bolster survey response on the quantitative piece, because last year I know Jeff had some suggestions about having the public health preparedness folks really push with the emergency management folks to get those responses in, but because of IRB restrictions, when you do a randomized survey, nobody can know that someone else is getting the survey, right? There are anonymity issues. So we've got to think through some of that about how we can bolster surveys. And then other feedback around the calls for new measures and the public comment mechanisms. We had some pieces like that last year. Where do we want to go with that? We'll talk about that next month. Other business, not the NAC chair. I put NAC chair. I meant work group chair. We would love to hear. If you are interested in chairing the work group next year, send me an email. If you would like to nominate a member to chair the work group next year, send me an email. I think that we want to explore who has the passion and the enthusiasm to help lead this group moving forward. And again, thanks to Kathy for her terrific service last year. Meeting dates and times for right now, we're going to hold stagnant. We're going to continue this fourth Tuesday, but we might explore moving that. We have a couple of new members who are not available on that time, and if we start talking about collaborating more closely with some of the other work groups, we might need to look at that. Are there any other issues before I thank you guys for staying with me an extra few minutes? Terrific. Well, thank you guys so much. Be looking for that email from me. I will get that out today. I look forward to hearing your thoughts on those pieces. We'll get the recording up as soon as possible. I apologize for forgetting to hit the record button in the May meeting. Too many fires being put out that day, so I am sorry, but we'll get some minutes up from that meeting. Mike Farnsworth took minutes, so we'll get those up, and we'll get this recording up as soon as we can. So thanks to everyone. Great meeting. Appreciate you all very much, and I look forward to your feedback via email and talking to you again next month. If you need anything in the meantime, give me a call. Thanks.
Could you,
Thank
when
you.
you're done here, could you give Doug Farquhar a real quick call on my cell?
I could, Doug. Do I have that number?
Yeah, 720-938-6480.
480. Will do. Thanks,
Yeah.
Doug.
Thank you.
Thanks, everyone. Have a great
Bye.
day.
Thank you. Bye-bye.